All right, so my body substance isolation on. That's because standard precautions for being in contact with the patient, as well as I'm going to be administering nitroglycerin, which will absorb into my hand if I do not wear the gloves. Okay, so you're having chest pain, correct?
Uh-huh.
How much does it hurt?
A lot.
A lot? Okay.
Yeah.
Sure, and you've been prescribed nitroglycerin by your
Yeah.
doctor, correct? Okay, so I'm going to take your nitroglycerin pills. Can you confirm your name?
Ashley Surratt.
Your date of birth?
6/15/04.
Okay, those are both correct. I'm going to check the pills. They seem to be intact. The expiration date on the pill bottle is January 15th, 2023. That is not passed yet, obviously. So at this point, I'm actually going to take your blood pressure real quick. I'm going to put that on. Taking the blood pressure. And your blood pressure is 140/80. So that meets the minimum requirements. You cannot give nitroglycerin to somebody lower than 100 systolic. Okay, so at this point, so I'm going to be prescribing you nitroglycerin today. First, I'm going to contact medical control. Patient as having chest pain. She's been given nitroglycerin by her doctor. Have you taken any pills yet?
No.
No? Okay, perfect. All right, and I get approval. So at this point, I'm going to confirm I have the right the 6 rights. So those would be the right medication, the right dose, the right time, the right patient, the right documentation, and the right route. So at this point, I have all that configured. I have asked for permission. I have my nitroglycerin here. So it's important. I'm going to place this nitroglycerin underneath your tongue. I'm sure you've done this before. You've been administered this before. So it's important that you don't chew it and crush it up. You just need to let this kind of dissolve underneath your tongue. Okay? So I wonder if you just open up here and kind of stick your tongue out. There you go. And boom. And then just let it digest. Keep your mouth closed. All right. Sorry, not digest. Let it absorb. So at this point, I've given her a vasodilator, which is why I checked your blood pressure beforehand, because it's going to open up the blood vessels. And if her blood pressure was low, that could lead to a shock. All right. And so at this point, you've absorbed the medication, right? Have you noticed any pain relief?
Yes.
Yes, okay, that's perfect. So at this point, I'm going to take her to the hospital. I'm going to reassess every 5 minutes. It's because she's a high priority patient. I've just given her a vasodilator. So I need to make sure I maintain good blood pressure in the patient. And so at this point, I believe we're done. Okay, so at this point, we've made it to the hospital. Everybody's good. Yay.